Hi guys, I'm Azar again, Doctor of Physical Therapy. Today is the sixth session about the neck. So we're gonna talk about some complications of the neck today. Actually, when we get a neck pain by itself is not that bad, and people sometimes can manage it somehow with the ice pack, heating pad, some kind of resting and strategies. But the complications are the problems. Sometimes people, after a while having the neck issue, like disc bulge or disc herniation, which is the cartilage tear or cartilage herniation, sometimes they get pushed on the nerve root here, and then people get numbness and tingling down through the hands and down through the arms. So that's the most important problems people complain. And also, if it's a progress situation of the problem, people sometimes can get weakness in the hand, which is very annoying. The grip can get weak, and then other shoulder movement can get weak and stuff like that. So first of all, we have to just do our routine exercises as we explained, stretches, strengthening, all of this. If none of them has been working, and also the pain medication and stuff that people try for decreasing inflammation of the nerve, we can have some solutions in physical therapy. One solution is the flossing the nerve. Yes, you hear correctly, flossing. Flossing is when you try to just make the nerve to move a little bit. Sometimes nerve traps underneath the inflammation. We may have inflammation here, down the road. And then anywhere that we have inflammation, it can get trapped and scar tissue there. And the movement, normal movement of a nerve can get compromised. If we don't have like good movement of the nerve is just like the other tissues, it needs to move. And if it gets stuck somewhere, it's very painful because it gets stretched out. So what we can do, we can actually do some exercises to help. That's the flossing exercises, nerve flossing. I want to show you the picture of the nerve, how they get exit from the vertebra in the cervical, and how they go down all the way to the hand. And we have three main nerves, which is shown here. Median, right there, okay? That's the median nerve, goes right here. Right in here, it shows you there, and then ulnar nerve right in here, okay? And then we also can have some problems in the other nerves in the body. And the little nerves that they go to the hands, that they all come off the neck, but we call it different names. We don't call it the nerve root problem. It may be here, we call it like cubital syndrome, whatever. We call it like carpal tunnel. You're probably very familiar with carpal tunnel. If the same nerve gets stuck in different area, it's different names. So if you're diagnosed with some of the nerve issues that basically comes from the neck, that's one of the best exercises. You can go ahead and bring your hand down like that, and then your head away from the hand. Now, so far we're familiar, the same position of the trapezius stretch that we already talked about. Your shoulder should be really down, okay? Your hand should be really like towards the back. Let me go over there so you can see better. Okay, so the palm of the hand should be down, and then you go like this, and up and down, just like dancing. You're basically flossing the nerve by doing that. And you may feel numbness and tingling down to the fingers, and that's normal, okay? And then while you're doing that, you probably get a little bit of relief, and then at the end you should feel a little bit better, but you have to keep doing that every day, maybe 30 times, 3 sets of 10. And then that's just for median nerve, very familiar nerve that goes mostly to that area, okay? Innervates the palm of the hand and mostly the first and second fingers. The second nerve that we want to talk about is the radial nerve. It's not as common to get trapped, but it still can get trapped in here, and different areas. So we can stretch it like this. As you can see, the palm of my hand's towards myself now. And then we do this. We feel a stretch in the back of our hand, okay, in the dorsal area of the hand by doing that. The third nerve is the ulnar nerve. The ones that when you hit your finger somewhere, you feel like that sensation all the way down to your pinky. That's the nerve that we want to talk about now, the ulnar nerve. How we stretch the ulnar nerve? It's a little bit tricky. So you're going to put our hand like this, okay, and then move your neck again away from it. And you may feel this really on your pinky, and which is normal. Okay, so all three main nerves of the neck we already stretched. This is very important exercise, very handy. It can help with the numbness and tingling, along with, of course, the medications that your doctor try to prescribe, and other exercises for the stability of the neck. Remember, when neck is not stable and it moves and it gets rubbed, so the disc can get rubbed, and then they can send the pain to the nerve, so you get nerve pinch. If you have all of this, treat that first, stabilize the neck, and do all of the exercises we already talked about. And this is the last solution if you still have numbness and tingling that's still there and doesn't go away. That was the video for today. I hope you could use it. Next time I want to talk about some other complications of the neck, especially the arteries that they are passing through the neck, going to the head, and they can cause some problems too. So that was today's video. Thank you for watching.